Hey, welcome to Socialism for All. This is S4A Livestream number 39 being recorded on September 3rd, 2022. My assistant Ben Shapiro has the day off. So, this is the fourth stream in as many days. That is a record. Actually, yesterday, doing 3 streams in 3 days was also a record. We're just pushing it. It's not going to be 5 for 5, though. I'm not going to be able to stream tomorrow, definitely. But yeah, it's good to be plowing through a lot of the material that I had, particularly on COVID-19. We've talked about some other things as well, as we always do in the streams. But I really have a big backlog of COVID stuff that I want to get through, particularly as we're heading into the fall. COVID is not over, and the U.S. government is about to roll out the BA4, BA5 oriented booster shot, which may or may not actually be the sort of saving grace that I think they clearly are hoping it's going to be. And I think it's crucially important for people to become as informed and knowledgeable about the actual risks of COVID that we are facing as the government goes basically hands off, sends kids back to school, no more quarantining, no more test to stay. Basically, just their position is COVID is real, but it's not a problem, and even if it is, shut up. That's the U.S. government's position. So I think that they're betting the farm on this one last vaccine, the booster shot. Unfortunately, there is evidence that while the initial vaccine was good, the booster shot was good, people's immunity from getting boosted and getting wild infections, you just catch COVID somewhere, it can build up your antibodies, but it can also deplete your B cells, and you're just not meant to get sick that often. And it may actually leave people less immune, more vulnerable, in other words, net, than protecting people against getting infected, which is really where the emphasis needs to be. You cannot run a vaccine-only strategy. They're trying to do this Hail Mary pass of like, as the fall is starting, doing this BA4, BA5 shot. Well, first of all, many people are not going to get the shot. We know that just from compliance with the uptake of boosters to date. Depending on what you're looking at, but only between 34% to 50% or 48% of people have gotten the booster. I was a little confused, actually. I was looking at this on the CDC website last night, and according to one thing that they had posted, it was like 34.8% or something like that of people have gotten boosted. And then another thing said 48%. I really could not account for it, at least the couple of minutes that I was briefly looking at it. But anyway, fewer than half of people have been boosted. Probably, not that many people are going to get this booster shot. And again, the boosters only take you so far. You have to control transmission. That means mask mandates. That means routine testing in schools and colleges. It means a lot of things that are not being done. It means contact tracing, etc. And, I know it's inconvenient. I know it costs resources. The fact is, this is a once-in-a-century pandemic, and if we want it to go away, we have to have a hand in that. Just letting it spread and spread and spread is not the best way to do it. That is the best way to get lots of people sick. COVID does not leave you stronger. It leaves you weaker. It injures your heart, brain, lungs, kidneys, gut, immune system, on and on. It leaves you weaker, not stronger. And that's why you see people getting COVID, over and over again. People have had COVID like half a dozen times. You're greatly upping your odds of various serious health problems every time you do that. Plus, there's a lot of evidence to indicate, well, we know that COVID can infect and kill T cells. So it's directly attacking your immune system. And we've seen people with long COVID especially having lowered T cell counts for up to a year after infection. So this is not good, and it's possible that we won't get into a huge problem this fall and winter. I think it's likely that we will, though. So again, trying to just get people as informed and knowledgeable going into this, because people have to start fighting back against this cover-up and downplaying of the harms of COVID. In the last 6 months, estimated, I'd say 5 to 6 million people, if you do 90,000 or 100,000 cases a day officially reported every day for 22 weeks since early April. Then we know that most of the cases aren't getting reported because of rapid tests, so double that. Then multiply by 20%, and you get about 5.5 million people who probably have long COVID now just from the last 6 months or less. So that's where we're at, and that's on top of all the people who had long COVID from the winter, and the people who are going to get it again, and on and on. So not a great situation. So I'm just going to get into it today. We have a number of articles about how universal health care would have been helpful during this pandemic in the United States. Of course, during the Democratic primaries, all of the candidates, except for the ones that are explicitly like self-identifying as right wing, but kind of the up and comers, the people who are trying to position themselves as they're trying to stake their career, like they're not as well known. The Kirsten Gillibrands and the Kamala Harrises and whatever, they'll come out and be like, I co-sign Medicare for all. I'm a supporter. And it's really just lip service, though. That was one of the earliest videos that I did on the channel, was really only Bernie Sanders was actually going out of his way to promote it in anything other than a lip service type of way. All these other candidates, Medicare for all is allowed in the Democratic Party as a carrot to get people to vote. As soon as they take office, they completely forget about it. Even Biden had public option on his campaign website, although he never talked about it. So they always use stuff like this. It's like Medicare for all, but then when pressed, it's like, well, actually, I'm for Medicare for all who want it. And there's an important point to make about that, which I used to make, back 2 years ago, when this was a big topic of discussion during the Democratic primary. And again, as soon as Bernie Sanders dropped out of the race, all of these issues and all these discussions went with it because he was no longer then, as a non-candidate, being invited on CNN and holding a space for these talking points in the mainstream discussion. But anyway, the important thing about medical insurance, and really any kind of shared risk pool, is you need everybody in the same risk pool to make it work. In other words, you can't just have all the people who are likely to use services and all in one pool, and then all the people who are not likely to use services in another. You need everybody in the same risk pool. That way, it's most effective, it's most efficient, the risk is most evenly distributed. The problem with something like Medicare for all who want it, while some people say that a public option would be Medicare for all in the installment plan, it could also result in a big disaster, which is known as an insurance death spiral. In other words, you get all the people who are high risk and using services in one pool, and then the costs go up and up because it's not being offset by people who are paying in but aren't using the services as much, which is how any insurance works. It's distributing the risk across the entire population, including mostly people who aren't being affected, in the most severe ways. There are also problems with the medical system as it is now in terms of there's a very small percentage of people who use almost all the care. Some people call it the 90-10 rule, 10% of the population uses 90% of the medical resources because of just whatever condition. But the fact is, we live in a society, etc., and we owe it to each other, as human beings trying to survive on this spinning ball of rock, to, help each other out. Otherwise, what? You just wind up with all against all. You don't want that. So anyway, we're going to talk about how Medicare for all would have been better in this situation, obviously. And we also have a long survey out of the UK of medical people and their opinions on the public health response that the UK did, and how many of the doctors and other providers didn't feel confident at all at how COVID was being handled. Those are kind of the two main things that I want to look at today. There's also another article about science denialism from last year, late 2021. Kind of want to see how that has held up in the wake of, the, quote, party of science in the U.S., the Democrats, pretty much abandoning any notion of trying to control transmission at this point. And that's pretty uniform, not just in the U.S., but many countries now. Before we get into that, let's thank the patrons whose names are on the screen, and this is updated for this month as of actually just this morning. And names in yellow have been supporting for over a year, and names in green have been supporting for over 2 years. This is the first month that people have made it into that category. So congratulations to Reverend Lawn Gnome Hollywood, Dan Sullivan, Potted Rodent, and Hitaka. Really appreciate the community that has been forming around S4A. Like, I'm the one behind the mic here on this channel, but you all are part of this community. Many people send in regular comments. They'll send links. We'll message on Twitter or Reddit or wherever. And all those contributions are huge and really have helped to make the channel what it is. You're also out there promoting the channel in your other communities that you're involved in. And just really appreciate everybody who has been supporting the channel in any way, whether it's on Patreon, patreon.com/socialismforall, or through the engagement, liking, sharing, subscribing, commenting. All of that helps YouTube to recommend this content to more people. And the channel has been growing a lot. We're coming up on 10,000. We're going to hit that this month. Absent some catastrophic failure, we're like 150 away from 10,000 subscribers. And I know that some of you are listening and aren't subscribed for one reason or another. But yeah, that's great. It's really nice to see the community growing. And we want to make sure that it continues to grow and to meet the needs of the community and to provide educational resources and to foster discussion that's actually going to meet the communist movement where it's at, so that the communist movement can meet the broader workers' movement where it's at, and can be relevant and helpful in the overall struggle for liberation from capitalism. All right, so let's just see what's going on in the chat. I see a bit more bickering in the chat than usual. I don't know. It could just be it's a Saturday and everybody's a little wound up. But see if there's anything there. There's a lot of just chat. And some discussion of Gonzalo thought. We won't be getting into that today. Yeah, Bernie Sanders is an old maid, not even socialist, or it says old man. That could either be old man, although that's not really relevant, or man. I'm not really sure. But anyway, Bernie Sanders is an old man, for what it's worth, not even socialist. Yeah, true. However, Bernie Sanders' campaign represented the opening of a space for people who generally were left in the United States to come together in a way that for once was not fringe. It was the most positive development on the left in decades in the United States, even though Bernie Sanders, obviously sold out the movement, didn't go independent or stay independent as he should have. He fed the movement into the Democratic Party, using the Democratic Party to get some publicity. That's acceptable. Sticking with them, not acceptable. Not acceptable. We need to redo the Bernie moment. I'm trying to say movement and moment at the same time, and that's wasn't going to result in a good word. Let's put it that way. We need to redo that moment, but outside the Democratic Party. That's what I'm calling for. I believe a left coalition is the best way to achieve that. This channel leans Marxist-Leninist strongly, but I do think it's probably going to, in practice, take a left coalition. We would obviously like Marxism-Leninism to be a strong part of that coalition, let's say, as it gets going. But rather than anarchism, I think there's a lot of decent anarchists out there. I don't think anarchism as an ideology is really going to be effective for the working class. That's kind of what we've seen over time. But anyway, yeah, I do think a left coalition at this point probably is the next step. Whatever comes after that, not really sure at this point. So, but like I said, Bernie Sanders' campaign represented the opening of a left space in relatively mainstream territory that, honestly, a lot of us on the left in the U.S. have been kind of dying for. It got topics to become household words that were completely suppressed previously. We need to do that again, but again, outside of Democratic Party control. So, yeah. Let's stop all the bickering in the chat, because this is going to make it impossible for me to interact with the chat at all, and I really don't want to start banning people, but The chat is pretty hard to read right now. Um, the communist movement is pure or nothing. So, yeah, Bernie Sanders isn't part of the communist movement. Let's just understand that. And yeah, I think actually somebody is going to need to be, somebody needs a timeout because this is just not really helpful. This is not how we do the S4A chat. Let's put it that way. So we're going to, person who just got banned, you're going to be let back in at the end of the stream, but you're really causing some problems. Anyway, yeah, Bernie Sanders is not a communist, right? The point is, a lot of people started being able to have discussions about left concepts as a part of that moment. I saw a lot of people personally come over to S4A who started out in the Bernie Sanders thing. It had real value. So it's on us now to build up Marxist education, etc., as much as we possibly can. So people, can say what they want. Sanders is 1950s Republican. Well, what does this say about the state of the left? You know what I mean? You can take these shots all you want, and Sanders deserves many of them. But the point is, we have work to do building the left, and we need to take advantage of every moment that we possibly can to grab some airtime for socialism. Now, Sanders was speaking to issues, broad popular reform issues that are very similar to what any socialist would propose as a transitional program to put demands on capitalism for the duration of capitalism. It's supportable in as far as that, although people, who know better, Marxists, also need to be clear about some of the obvious limitations of somebody like Bernie Sanders. So we do need to be clear with that, with people about that, as we do our education. It can't be just uncritical support for Sanders. But again, I'll stand by the statement that that was the best thing that happened to the left. I mean, the start of that campaign anyway. I really don't like what Sanders did with it. He needed to stay independent, not go into the Democrats, and that's something he still has not corrected. He never took responsibility for that sellout. But, I mean, people came to this channel as a result of being involved in that movement, and it has resulted in the growth of the actual Marxist, left in the United States. The fact is, Marxism in the United States has never been particularly strong, and we need to build it and not just give up on it as so many people have before. And it's not going to be an easy fight. Are we past that now? Somebody says it was a start, but we're past that now. Are we? I mean, you and I are, but how many millions of people aren't? So there's a lot of people that do still need to be pried out of the clutches of the Democratic Party, who Sanders maybe took them from being, a more middle-of-the-road Democrat to supporting a lot more, deeper reforms that the Democratic Party opposes with everything that they have. So they need to still move left. But this is, I've talked about many times how the masses need to come to the conclusions that you and I have come to. We can't just transfer them out of our minds via telepathy directly to them. They have to go through the thought process that you and I have. So we can, as part of the education and agitation efforts that we do, we can try to help move them along, engage them constructively in, techniques to realize what the Democratic Party is about, because the fundamental task of the U.S. left is to break with the Democratic Party completely and with all capitalist parties. But the people aren't there yet. A lot of people have positions that are far to the left of the Democratic Party, but they're still clinging to the Democratic Party. Well, again, I think we need a left coalition that's going to give people an option where they can actually keep moving left. You saw the desire and the demand. I was way left of Bernie Sanders, but I did critically support that because, again, I've been doing this for like 20 years, and that was one of the best moments I've seen as far as mainstream left discussions happening in the United States. Um, I don't know why you wouldn't support that. It brought a lot of people further left. We obviously needed to continue that process outside the Democratic Party, but it was a massive step forward. And again, you and I might be left of that, but if we want to actually rally the millions to tens of millions of people um, who we need to rally to make this movement really strong enough to be what it needs to be, we have to keep at it. So it's not enough to just merely like hurl insults at Sanders. You have to engage with the phenomena that are actually happening there. And I have my moments of frustration with it as well. But the fact remains, it's frustrating work, but it's work that has to be done. Question: have I seen the popular subreddit anti-work? I've heard about it and briefly looked at it, but I'm not really a Redditor, so I don't spend a lot of time on there. I do post a lot of the audiobooks there, but I don't spend a lot of time on it. I'm more likely to use Twitter. Used to use Facebook, don't miss it at all. I have, and some stuff does seem to verge on class consciousness. Bernie had the policy stance of full employment as opposed to the BMI that some supported. You mean UBI? I think you mean UBI. Can full employment also include time off for COVID and fewer days in general as people realize that the 40-hour work week is a scam? Yes, absolutely. Like, working for the revolution is important, but we have our mental and physical health to consider. Yes, so a guarantee of full employment, and yes, also a program of fewer working hours is entirely possible and within reach. And, it's always been a tenet of socialism that people have the right to work and a dignified living, not to just be discarded by capitalists during economic downturns, thrown away like a piece of trash. That's, yeah. And yeah, it'd be far better, even in a recession, far better to have everybody working 20 hours a week and, have some purpose and ability to stand on their feet than nothing at all. In fact, some in the labor movement will refer to people who like do overtime and stuff like that as scabbing against the unemployed. So yeah, we need to share what we have, and some of this though at this point in time is moot. Like, some of that comes from 80 years ago when there was still some actual natural scarcity. At this point, all the scarcity is basically artificial. So people could work a lot less, have more free time, and still not have to worry about making a living. So yeah, you could have full employment with fewer hours than and most people in the U.S. I think the average is well over 40 hours. Like, the average U.S. work week is closer to 50. There's European countries where it's like 35 or 30. In the U.S., it's more. So the average work week is actually longer than that. So even getting back to 40, getting back to an 8-hour workday at this point would be progress. We've actually slipped away from that. So yeah, anyway, it didn't seem like there was a larger question in there, but I would say yes generally. Reformists probably won't come around at this point. Support your statement. I don't know why you're saying that, and I can't really engage with that. I mean, I've seen reformists come around at this point. So I disagree with your statement, but because you have not provided any evidence or reasoning, I can't really evaluate that. But there is a chance to win over anarcho-communists to the ML camp. It might come from anywhere, but again, I don't know where you're coming from, so I can't really comment. I understand there's infrastructure to rebuild as well. Yeah, I mean, this is the whole thing with like neoliberal capitalism is the sort of contrarianism you see from libertarians. It's reflective, I think, generally of the consensus that is rippling through capitalists in general. They want to halt certain kinds of progress in the development of capitalism at this point. They would rather let capitalism like rot and die on the vine rather than pushing it forward and risking, struggles over wages, and then, we get closer and closer to the actual abolition of capitalism. We've seen like regression almost to like, in some ways, earlier types of production. So, yeah. There's some dumb trolls that show up. Spider, you're awful feisty today. I honestly don't understand where some of you're having a bad day. Some of your comments, I'm just not really getting it. My last job was 50 a week, 5 days a week, work on my day off if I was sick and missed a day. Sucked. Clopens. So clopening is when you have the late shift and you close up the shop, and then the next morning you're back to open up first shift. That sucks. Libertarians are neo-feudalists and capitalists want. So you're using a kind of buzzword there, great reset to the system. That's not really... I'm going to just move on from that comment right now. But let's get into the COVID stuff. Like I said, this is a testy chat today for some reason. And I say that having done, this is the 4th stream in a row. You guys need to relax. Like, seriously, relax. Bernie moment without Bernie, or do you think Bernie will stop sheepdogging for the Democrats? Bernie moment without Bernie, for sure. No, Bernie has had many chances. Okay, you meant to just say a reset, fine. Yeah, I agree. There probably will be a world war and then a resettling of accounts among the capitalists in terms of who controls what. But yeah, I do think we're headed down that road now for sure. Okay. Yeah, but Bernie moment without Bernie for sure. I do think we have, and that can be the slogan for the whole thing is, do you like what Bernie Sanders did? We're going to take it the rest of the way. Bernie can only go so far. Bernie has shown himself to be unwilling. He's with her. Bernie has shown himself to be unwilling to do the things necessary to deliver on the kind of things that he was talking about in his campaign. So this is like, people need to stop thinking in terms of just liking to hear themselves complain. So if you can point this out, it would be much better than pointing it out in fucking internet comments? Go do something about it. Join a party, or if you're in a party already, raise it at your party of, hey, we should do a campaign agitating people who followed Bernie Sanders, liked what he had to say, but pointing out the obvious truth, and it might not be obvious to everybody, but it's obvious to communists, that the things that Bernie was talking about are never going to be realized within the Democratic Party. And if you're serious about that struggle, then you have to get out of the Democratic Party, join the left coalition, and we will continue where Bernie left off. It's a no-brainer. That's an obvious campaign. Is it being done? By some, but is it being done consistently and loudly and with enough of a presence? No, it isn't. But yeah, this isn't about listening to yourself complain in an internet comments section. Go do something about it. I'm always telling people, come to S4A, get some audiobooks, listen to a discussion. It's meant to perk you up and get your brain going. But the struggle is happening in the real world. You have to go into the real world, and whether it's a labor union, a tenants union, community organizing, whatever it is, that's where it is. You have to take that stimulation and then go apply it out in the struggle. That's what you have to do. So you got to log off and do that at some point. So, all right. Let's get into our stuff for the day. Speaking of all of this stuff, let's hear from Joe Biden, and Bernie Sanders is going to be on stage, about Medicare for All, and then we will read an article about how that would be helping during the pandemic right now, contrary to what Biden is about to tell you in this clip. Here we go.
Experts are saying the only true way to control this virus is through a national quarantine, requiring every American other than essential personnel to stay home. Would you take that unprecedented step of a national lockdown?
What I would do is what we did in our administration. I would call a meeting in the Situation Room of all the experts in America dealing with this crisis. I would sit them down and I would do exactly what we did then. What is it that we need? Listen to the experts. What do we need? And with all due respect to Medicare for all, you have a single payer system in Italy. It doesn't work there. It has nothing to do with Medicare for all. That would not solve the problem at all. We can take care of that right now by making sure that no one has to pay for treatment, period, because of the crisis. No one has to pay for whatever drugs are needed, period, because of the crisis. No one has to pay for hospitalization because of the crisis, period. That is a national emergency, and that's how it's handled. It is not working in Italy right now, and they have a single payer.
So, at least, for the sake of the quote national emergency, Biden literally was just basically describing a free at the point of service system. So he's like, Medicare for all, that wouldn't work. What we need is Medicare for all for the duration of the pandemic. Well, he didn't really do that either. Some things were free, but they started rolling that back really the moment that they could. So, yeah, somebody just said he's Trump without Twitter. For sure. Biden actually gives me strong, George W. Bush vibes. George W. Bush was funnier. He was loathsome, but, that's who Biden reminds me of, as George W. Bush. And just the sort of misery of sitting through that. The messaging is slightly more positive, but the results are reminding me of the Bush-Cheney years. Anyway, so here's the article. Study, actually. Universal Healthcare as Pandemic Preparedness, the Lives and Costs That Could Have Been Saved During the COVID-19 Pandemic by Galvani Parpia. I'm sorry, this is tiny on my screen. Panday and Fitzpatrick, published June 13, 2022. And let's get going. So, significance. The fragmented and inefficient healthcare system in the United States leads to many preventable deaths and unnecessary costs every year. Universal healthcare could have alleviated the mortality caused by a confluence of negative COVID-related factors. Incorporating the demography of the uninsured with age-specific COVID-19 and non-pandemic mortality, we estimated that a single-payer universal healthcare system would have saved 212,000 lives in 2020 alone. We also calculated that 105.6 billion US dollars of medical expenses associated with COVID-19 hospitalization could have been averted by a Medicare for all system. So let me just say, this is all part of the reason why we don't have Medicare for all, because people say oh, well, Medicare for all would be cheaper. Yeah, but you don't get it. So, that money's going to somebody who wants it to keep going to them. That's actually the problem here. But yeah, as far as 212,000 lives, that was roughly half of who died in the pandemic in 2020. So that would be enormous. If you could cut mortality in half, that would be enormous. Anyone against that, it's just anti-human. Anyway, continuing. Abstract. The fragmented and inefficient healthcare system in the United States leads to many preventable deaths and unnecessary costs every year. During a pandemic, the lives saved and economic benefits of a single-payer universal healthcare system relative to the status quo would be even greater. In other words, it would be even greater during a pandemic. For U.S. Americans who are uninsured and underinsured, which is many, financial barriers to COVID-19 care delayed diagnosis and exacerbated transmission. I just have to say, I'm getting a little bit flabbergasted because it's so infuriating looking back at this whole thing, how much could have been avoided, and all of the political gyrations that were done to avoid saving lives in defense of this system. So yeah, it did delay diagnosis, exacerbate transmission, etc. So concurrently, deaths beyond COVID-19 accrued from the background rate of uninsurance. Universal healthcare would alleviate the mortality caused by the confluence of these factors. To evaluate the repercussions of incomplete insurance coverage in 2020, we calculated the elevated mortality is death rate, attributable to the loss of employer-sponsored insurance and to background rates of uninsurance, summing with the increased COVID-19 mortality due to low insurance coverage. Incorporating the demography of the uninsured with age-specific COVID-19 and non-pandemic mortality, we estimated that a single-payer universal healthcare system would have saved about 212,000 lives in 2020 alone. We also calculated that $105.5 billion US in medical expenses associated with COVID-19 hospitalization could have been averted by single-payer universal healthcare over the course of the pandemic. These economic benefits are in addition to $438 billion expected to be saved by single-payer universal healthcare during a non-pandemic year. And of course, there were studies on this. It came up in the 2020 Democratic primary. I believe it was a Yale study showing how much money would be saved and how many lives would be saved, even in non-pandemic years, because of course the pandemic had not happened at that point. So continuing, despite spending more on healthcare than any other country, both overall and on a per capita basis, the United States does not provide universal healthcare, resulting in preventable deaths and excessive costs. In 2019, prior to the emergence of severe acute respiratory syndrome coronavirus 2, SARS coronavirus 2, over 28 million adults were uninsured, an increase of 2.2 million from 2016. Since 2010, the COVID-19 pandemic has underscored the public health, economic, and moral repercussions of widespread dependence on employer-sponsored insurance, the most common source of coverage for working-age Americans. Business closures and restrictions led to unemployment for more than 9 million individuals following the emergence of COVID-19. Consequently, many U.S. Americans lost their health care precisely at a time when COVID-19 sharply heightened the need for medical services. So to comment there, as far as what Biden was saying, this wouldn't help at all. And he says, look at Italy. They have it and it's not helping. I mean, you still have pandemics when you have universal health care. It's just that the way that you pay for them and the way that people are able to seek treatment is different. And outcomes would have been worse in Italy without that. So he doesn't qualify in that clip that we played. What do you mean by it didn't work? It absolutely did work. It's not like Italy doesn't have a medical system. It worked. It's just that you still get disease outbreaks, which is why you have the system in the first place, in addition to all the other, care for chronic conditions that people need. Anyway, with over 973,000 reported deaths attributed to COVID-19 as of 14 March 2022, the United States represents 16% of the documented worldwide mortality burden of the virus, while only composing 4% of the global population. Inadequate health insurance coverage has exacerbated the COVID-19 pandemic on both individual and population levels. At the individual level, concerns over medical expenses delay diagnosis and treatment, elevating case fatality rates. At the population level, postponement of diagnosis and thus of case isolation fuels transmission. In addition, fear of losing employer-sponsored health insurance during a pandemic may make it untenable for people to miss work even when they feel unwell. It's another reason that there have been campaigns for paid sick days, things like that. Many people work without any kind of paid sick leave in their job contract or their job agreement. We quantify the financial benefits and lives saved if the United States had provided universal health care coverage to all individuals during the COVID-19 pandemic. As proposed by the Medicare for All Acts of 2019 and 2021, a major feature of such reform would be elimination of the high deductibles and copays that currently make medical services unaffordable, even among many who are nominally insured. So you can have insurance, but the costs are still too high for you to really be able to afford the things that you need. Ramifications of pandemic-driven unemployment for health insurance coverage. While stay-at-home orders and temporary closures of non-essential businesses curbed the immediate spread of COVID-19 and prevented catastrophic demands on hospital capacity, the measures also led to spikes in unemployment. For employees, a layoff often results in insurance loss or the need to switch to a different type. To determine the changes in coverage by insurance type over the course of 2020, we combined data on monthly Medicaid and Children's Health Insurance Program, or CHIP, enrollment, monthly employment, and employer-sponsored health insurance plan participation rates, as well as insurance exchange enrollment during both the standard and special enrollment periods. We calculated the difference in insurance enrollments for each month of 2020 compared to December 2019, the final month prior to pandemic disruptions. In March 2020, employment dipped slightly, followed by a steep drop in April, precipitating a loss of 14.5 million employer-sponsored insurance enrollments compared to December 2019. Employment gradually rebounded, but remained below its December 2019 level throughout 2020. You can see some graphics there. Concurrent with reductions in employer-sponsored insurance over the course of 2020, Medicaid and CHIP enrollments rose steadily from 71.6 million in March 2020 to 80.2 million in December 2020. There were fewer total insurance enrollments from March through September 2020 compared to December 2019, but increasing Medicaid and CHIP enrollment boosted total insurance enrollment to 3.5 million above that baseline by December 2020. Increased Medicaid enrollments in 2020 may be a response to unemployment, the result of ongoing Medicaid expansion efforts, or due to individual perception of elevated risk during the pandemic. Another driver may be the disaggregation of family members previously covered together under an employer-sponsored family plan. So disaggregation means ungrouping. So previously family members may have been covered as a group, and then that insurance coverage group may have fallen apart. On average, each employer-sponsored enrollment covers more than one individual. Some individuals may be eligible for employer-sponsored coverage through their spouse, or may opt to purchase insurance, such that unemployment does not necessarily lead to becoming uninsured. Conversely, job loss may be associated with the loss of insurance for an entire family, potentially resulting in separate enrollments into Medicaid or CHIP for each family member. Such events might appear from the federal data as an increase in enrollments, when in reality the same number of individuals have coverage prior and subsequent to the job loss. So in other words, they'd be counting people individually who it might not actually be a change, but it would look like one due to the difference in counting. Due to this disaggregation, the apparent rise in Medicaid and CHIP enrollments may not have translated to higher overall coverage, and the pandemic-driven insurance gap may have persisted longer than indicated by the raw data. So in other words, you can say the numbers went up, but it may be really because they're counting people individually rather than as numbers of groups. Despite these sources of uncertainty, U.S. Census Bureau data indicate that more Americans were uninsured at some point in 2020 compared to 2018. Consistent with our evaluation, April was the most common month for insurance loss in 2020, contrasting with non-pandemic years. Insurance gap prior to the COVID-19 pandemic. The pandemic-driven changes occurred against a backdrop of pre-existing incomplete insurance coverage. To evaluate coverage when SARS coronavirus 2 emerged, we calculated the age-specific number of uninsured individuals in 2019 by applying the change in overall reported coverage between 2018 and 2019 to the 2018 coverage in each age cohort. We estimated that almost 41 million, 40,963,000 Americans were uninsured in 2019. Read that again. About 41 million Americans were uninsured in 2019, just prior to the start of the pandemic. Life-saving potential of universal health care. Quantifying lives that could be saved by universal health care in non-pandemic conditions. So, when Joe Biden makes those kinds of statements, he's just directly, bluntly lying. And Democrats know this. Like, Obamacare, the ACA, it gave people, including me, crappy care that barely covered anything. I was able to get like checkups, but the coverage was terrible. And even like some of the things that came up in checkups, it's like it didn't even get addressed in a follow-up. So it's not good coverage. There's a lot of problems, not just wrong with the insurance, but like with the medical system. Trying to get like decent health care, like go to your provider, whether it's an MD or a nurse practitioner or whatever, and getting their full attention and actually getting your problems addressed in a timely way. Forget it. People talk about, quote, wait times being worse, for example, in Canada. Actually, first of all, that's one of the only metrics that Canada has ever been even slightly worse than the US on, which is why you constantly hear that. I think like for a time, Canada was like ranking one notch below the US on the wait times. But again, that's like taking into account that many people don't even go to the doctor. So if everybody in the United States, let's take those 41 million people, for example, who don't have coverage, factor them in. Let's say they all started going to the doctor. What would that do to the overall wait times, etc.? So anyway, people like Biden, they're lying, And the thing about the Democrats is they'll often say, well, you got basically three tiers that I can think of off the top of my head. You got Medicare for all, that's what we actually need. Then you've got public option slash Medicare for all who want it. That's really just a bastardization of Medicare for all. They don't really mean it. It's just something that they can say to confuse people with. But it wouldn't work due to the death spiral thing that we were talking about before. And then there is, we need to just keep the ACA and keep improving it. Well, they're not really doing any of those things. So every time that they give you something instead of Medicare for all, it's literally just to like waste your time, distract you, confuse you, etc. All right. Demographic shifts and the expanding insurance gap combined to increase the annual lives that could have been saved by the provision of universal health care compared to our previous analysis, even in the absence of COVID-19. We previously calculated that enacting universal health care would have saved over 68,000 lives in 2017. To update this analysis to the most recent non-pandemic year, we took into account the proportion of uninsured in each age class for 2019, the size of every age class, age-specific life expectancy, and the elevation in mortality associated with lacking insurance. So in other words, the amount of years shaved off of your life by the fact that you don't have insurance. Our calculations indicate that 76,064 lives would have been saved by universal health care among individuals of all ages in 2019. Incorporating the life expectancy of the lives that were lost, we further calculated that 2,094,000 years of life would have been saved by universal health care in 2019, an increase of 360,519 compared to our calculation for 2017. The greater loss of lives is due both to a widened insurance gap and to a rise in the average age of an uninsured individual. We also evaluated the deaths and years of life lost that are attributable to uninsurance for 2020 based on demographic trends for the counterfactual scenario where the COVID-19 pandemic didn't occur. Using 2019 estimates for age-specific coverage and updating with 2020 population growth, we estimated that there were 77,675 excess deaths and 2,099,133 excess years of life lost in 2020 due to lack of insurance without including repercussions from the pandemic. So that's without even incorporating the pandemic. That was what was lost by not having universal health care. And let's note also, they say the greater loss of lives is due both to a widened insurance gap, so more people don't have coverage, and a rise in the average age of an uninsured individual. So it used to be that as people got older, they had a certain likelihood to have insurance, and now it became more likely at an older age to still be uninsured or to be newly uninsured or whatever. Okay. In addition to those without insurance, another 45.3 million adults are underinsured, burdened by copays and deductibles that are not affordable relative to their salary. So that was the situation I was describing for me, like a bronze plan holder under the ACA. Underinsured Americans often forgo health care that they require, thereby increasing their risks of mortality. Consequently, our estimates are conservative with regard to the life-saving benefits of comprehensive universal health care that eliminates all costs to the patient. So it sounds like you can't even really cover the underinsurance. They're just counting people who aren't insured at all. But their analysis sounds like does not include people who are counted as insured, but really they're falling into that insurance gap because they have insurance, but they can't really use it or it doesn't do very much. As well as demographic shifts, a lot of the terminology in this kind of is echoed, so sometimes I think I'm like rereading something. As well as demographic shifts during 2019, loss of employment and therefore insurance coverage during the COVID-19 pandemic further contributes to premature mortality. Using the same methods detailed in quantifying lives that could be saved by universal healthcare in non-pandemic conditions, their previous study, for age-specific elevations in mortality among the uninsured, we estimated the mortality impact specifically among those who experienced pandemic-driven job loss. Given the high Medicare coverage among elderly, we applied the pandemic-driven enrollment changes only to those under 65 years of age. While coverage rose toward the end of 2020, These gains were insufficient to compensate for the extent of lower enrollment early in the pandemic. Incorporating both the widening and then contracting insurance gap, we estimated 2,784 lives lost over the course of the year. From the combination of pandemic-related and background uninsurance, we calculate 80,459 excess deaths and 2.2 million years of life lost in 2020. We previously calculated that 26.4% of the lives that were reported to be lost due to COVID-19 would likely have been saved if there had been universal health care throughout the pandemic. In addition, it has been estimated that 24.1% of COVID-19 fatalities were not documented on death certificates. In 2020, 377,883 deaths from COVID-19 were recorded, implying almost 500,000 actual deaths, of which 131,000 could have been averted if the United States had universal health care. Therefore, the number of lives that could have been saved in 2020 by universal health care from both non-COVID conditions and COVID-19 would be 211,897. Across the entire time, so I said before that was half of the people who died from COVID. So not all of it was COVID, although a decent amount were. So as described there. Across the entire time frame of the pandemic thus far, 973,459 COVID-19 deaths have been recorded in the United States, meaning that there were actually 1,282,555 deaths due to COVID in the United States. Therefore, 338,594 COVID deaths are attributable to incomplete insurance coverage in the United States. Mechanisms by which Medicare for All would save lives and avert morbidity is illness, during a pandemic. The observed relationship between healthcare coverage and COVID-19 mortality is attributable to multiple factors as detailed below. 1. Improved access to primary care and reduction in comorbidities. So this is something that the minimizers always say is, oh, you had pre-existing conditions. Well, literally over 80% of people in the United States have at least one pre-existing condition, which makes you more likely to suffer worse outcomes of COVID-19. But then do they want to do anything about improving the overall background healthcare system, which would be helping people to manage and perhaps even eliminate those conditions, which would make them more likely to die from COVID? No, of course not. It's all just excuses. It's all just runaround. It's all just time wasting when we should be organizing based on the facts. First, the prevalence of those underlying conditions which exacerbate COVID-19 severity would be reduced via equitable access to care. For example, uninsured adults are significantly more likely than insured adults to be unaware of their hypertension, high blood pressure, much less likely to be receiving treatment, and much less likely to have their hypertension under control. Hypertension specifically increases the risk of COVID-19 mortality by 188%. Additionally, uninsured women were found to have a higher prevalence of obesity, which is another risk factor for severe COVID-19. Diabetes has similarly been associated with significantly increased COVID-19 severity and mortality. Uninsured adults with diabetes were half as likely to be aware of their condition as their uninsured counterparts. So people who don't have insurance, you're not getting the checkups, you're not getting blood tests, you're not being examined, you are half as likely to be aware that you have developed diabetes as somebody who is having those medical interventions of a checkup. Early diagnosis and access to life-saving medical care. Financial barriers reduce and delay care for COVID-19. Due to apprehension about their ability to pay, 14% of U.S. adults reported that even if they experienced the two most common symptoms of COVID-19, fever and dry cough, they would still avoid seeking care. The financial concerns are justified, as 18% of the U.S. population had medical debt even prior to the pandemic, collectively totaling $140 billion. Medical debt ballooned further during the pandemic as the confluence of lost insurance and lost income makes it more challenging to pay medical bills. Removing financial obstacles to care can accelerate diagnosis. More timely medical attention increases the probability of recovery from COVID-19 infection. For example, treatment with monoclonal antibodies early during the infection reduced the risk of severe outcomes, hospitalization or death, by 85%. Reducing the time to diagnosis also ensures more prompt isolation, which in turn reduces transmission to others. So there's a lot said in that paragraph. Just to summarize quickly, people were already in a bad financial situation with regard to medical debt and stuff even before the pandemic. Then the pandemic starts, they lose their income. The payments that the U.S. made for people to stay at home were not enough. They were unrealistically low. And for not for everyone, but for a decent amount of people, it wasn't enough. So they should have been paying more. And, people should have been rallying for that rather than agitating for people to be allowed to go back to work. We should have been agitating for more of that. But again, workers' movement, badly fragmented and weak in this country. But so you lose your income, you lose your insurance, and you're less likely to be able to access medical care than before. And if you are delaying going to the doctor, you're probably spreading COVID to more people. You're not getting treated as early. Your disease is probably progressing to more advanced stages than people who are getting treatment, et cetera, et cetera. This also increases mutations because people whose bodies are overrun with the virus for weeks and weeks are the people most likely to be generating the mutations, because the virus is just, you're giving it lots of time to just experiment with your body. Let's put it that way. The Coronavirus Aid, Relief, and Economic Security, or CARES Act, subsidizes all testing and medical bills for the uninsured with COVID-19. However, hurdles still exist that may prevent individuals from seeking care. Since this program does not directly offer insurance to patients, this is the first thing I was going to say, uninsured individuals may be unaware that their COVID-19 related medical expenses can be reimbursed, which may prevent them from seeking treatment. So it's like, yeah, the CARES Act may have done some of that, but did people even know? Huge question. Furthermore, the CARES Act provides financial assistance for only one disease. It is a possibility that people without insurance and seeking medical care for COVID might be billed for a different diagnosis or other services associated with testing. So, let's say you haven't been to the doctor in 4 or 5 years. You go in for COVID because COVID's covered, and then they find out that you're a diabetic and you have sleep apnea and, you have high blood pressure and whatever else. And then they do something for that, and then that's not covered, and then you get a bill for $1,000. So, geographic inequalities in healthcare access have exacerbated case fatality rates in the United States. Specific provisions in the Medicare for All 2021 bill to iteratively monitor and address geographic and racial inequity would have particular importance during a pandemic. Rural hospitals are disproportionately reimbursed at the relatively low rates paid by Medicaid and have heavy burdens of uncompensated care, which has challenged the survival of rural facilities. So this is basically a thing where I think everywhere in the United States, if you are running an emergency care facility, whether it's an urgent care, like one of those like rapid clinics or whatever, or an emergency room or whatever, you have to treat people regardless of their ability to pay. You can bill them, you can send, debt collectors after them after the fact, but you may never get that money, and you're legally required to give them that care. So a lot of people just go to the ER and because they need to get something done, and they know that the ER has to treat them. And this is another problem with outside of COVID with the medical system, is because 41 million people don't have insurance, but some of those 41 million people do have health problems, as we all develop eventually. They go to the ER, and the ER is supposed to be treating people who accidentally cut their finger off or are having, sudden, severe, unexplainable internal pain or whatever. And so the ERs are getting clogged up with people who really should be just making an appointment with their general provider, but they don't have a general provider because the system is not set up to actually cover everybody. Anyway, when they talk about the heavy burden of uncompensated care, that's some of it. Anyway, although hospital fees nationwide would be reduced by Medicare for All, applying Medicare rates across the board would actually increase support to those rural hospitals, which currently serve substantial populations of Medicaid and uninsured patients. Furthermore, clinical outcomes such as mortality have been elevated among rural communities during the COVID-19 pandemic. Rural hospitals were more prone to shortages of ventilators, personal protective equipment, PPE, intensive care unit capacity, and healthcare workers. These factors would be rectified by investment to expand healthcare facilities and hospital capacity in rural areas. Next, facilitation of COVID-19 preventative measures. COVID-19 mortality rates have been higher and vaccination rates lower among Black and Hispanic individuals relative to white individuals. A key driver of these disparities is inequitable access to primary care. For example, recommendation of COVID-19 vaccination to patients by their trusted primary care providers is effective in overcoming vaccine hesitancy. Consequently, it's unsurprising that individuals without access to a PCP have lower rates of vaccine uptake despite its being free to the public because they don't have a trusted provider convincing them to get it. Universal healthcare would ameliorate such inequity, and so they listen to fucking Jimmy Dore instead. Universal healthcare would ameliorate such inequities, particularly given the provisions for investment to address racial and other disparities. And I say Jimmy Dore, it's one example on the quote left here, but it could be Tucker Carlson or somebody that has millions more people listening. Universal healthcare would ameliorate such inequities, particularly given the provisions for investment to address racial and other disparities. Again, intersectionality matters. Yes, this is a general working class issue, but it does hit some communities particularly hard. So you start with class and then add other statuses to get additional details. Sometimes it's the same across all other statuses. Sometimes it isn't. Intersectionality matters. Alleviating pressure on hospitals during a pandemic. Beyond COVID-19 outcomes, high hospital caseloads impact non-COVID care and also lead to premature death from non-COVID causes during a pandemic. Removal of cost barriers and alleviation of comorbidities, that's simultaneously occurring sicknesses, would have reduced not only the risk of COVID-19 death, but also hospitalizations, with positive externalities specific to the pandemic context. Particularly during outbreak surges, high demand for COVID-19 hospital services often delayed procedures related to other health conditions. So I heard that recently somebody had to get a whole blood transfusion in the ER because every bed in the hospital was taken up by COVID-19 patients. Reduced hospitalization rates, and people need some other kind of medical procedure and it's getting pushed back by months because the facility is dealing with COVID, which is more of an emergent infectious condition. Reduced hospitalization rates facilitated by Medicare for All would have blunted these COVID-19 peaks and thereby freed capacity for non-COVID care. Next, fully addressing health disparities requires a multifactorial strategy. Not just one thing is going to do it. Not all disparities in COVID-19 mortality could have been alleviated by adoption of a single-payer universal healthcare system. Even in countries with single-payer healthcare systems, there can be a steep income gradient associated with COVID-19 outcomes. While single-payer healthcare is paramount, most important, to addressing health disparities in the United States, the challenge is multifactorial. Pervasive inequities regarding income, education, and housing impact nutrition, mental health, exposure to pollution, and feasibility of accessing healthcare services. Paid sick leave, nutrition programs, and affordable housing are among initiatives that are necessary to alleviate disease burdens overall and mitigate systemic gaps in health. So yes, the medical system is an important prong of public health and population health generally. But there's also all the other stuff. Housing, mental health, level of education, and the quote cultural capital as far as people being able to know how to really take the best care of themselves that they can, and then actually having the opportunities to do all the things that would be the best day-to-day self-care that they can, etc. So there are other factors that would also have reduced or lessened COVID-19 mortality. This wouldn't be a magic bullet to end all of it. You would still see differences along, generally lines of class that filter into things like education and income level and things like that, housing status, things like that. But this would be a pretty big thing at taking care of a lot of it in one swoop, and then also starting to make inroads on the rest. Because what can you do when more people are showing up to checkups and things like that. Well, you can give patients questionnaires about the rest of their life situation, and then you can gather more data about, okay, what other public health interventions do we need? How do we keep making a healthier population? Well, you need the data on how people are living in the first place. So that can help with that. But, if you're not getting people in the door, then you're not having that contact to ask them that stuff. And, again, if you're not trusted, people might not feel comfortable sharing that information. I think you see that with libertarians. So for a long time, I don't know if they still do it, the Libertarian Party led efforts to resist census data collection. Like, they just want people counting heads, and that's it for the census. They don't want any other information. Why? Because that other information is used to, like, target social programs where they're needed, for example, among other things. But there's another point to that, too. A lot of people I've met who are libertarians have kind of a trauma background, and one of the reactions, it seems like, that can be to embrace the sort of fanatical, blind, very unprincipled, very unqualified pursuit of, quote, freedom, because they had previously been in a controlling situation or something like that. People really need to understand that that's a pathological and self-destructive response. It's not really helping. Anyway, worth mentioning. Continuing, economic savings that could have been realized by single-payer universal health care during the COVID-19 pandemic. We calculated the economic savings of a single-payer universal health care system in 2020 relative to status quo by examining two sets of costs: medical costs unrelated to COVID and those related to COVID treatment. National healthcare costs unrelated to COVID-19. Per capita healthcare spending in the U.S. increased, per capita spending in the U.S. increased from $10,682 in 2017 to $11,582. That's per capita in 2019. I knew it was a lot. The last time I checked, it was high, but not like 11,500. Anyway, we previously calculated, and by the way, if you compare that to like Europe, Japan, other highly developed countries, it's nowhere near that. It's like 3,000 on average. So the U.S. is like at least triple what most other countries are able to do. Anyway, we previously calculated the single-payer universal healthcare system would have saved $458 billion in 2017. Well, it would have saved us, that money, but that's money that the health profiteers, medical profiteers, wouldn't have gotten their greedy mitts on. There are several factors driving these savings: streamlined administration, negotiated pharmaceutical prices, and the application of the Medicare fee schedule throughout the healthcare system are major reforms that would achieve substantial reductions in national medical costs. So, one, streamlined administration. That is very true. The Medicare administration costs are like 3%. It's much higher in the private insurance administration system. Two, negotiated pharmaceutical prices. So let's just say this. The United States is the only advanced country that does not negotiate its medical budget on an annual basis on behalf of the population. So, it's just like collective bargaining of any type, like in a labor union. You do better when you bargain collectively, and you wind up spending $11,500 per capita when you don't, because that's how it is. An application of the Medicare fee schedule throughout the healthcare system. So some people try to make this out to say that doctors would suddenly become paupers. That's really not the case. If you look at any country that's done this, doctors are still quite wealthy. So anyway, combined, the savings from these mechanisms more than compensate for the expanded utilization when coverage is extended to the entire population. So yes, more people will use services. Overall, the cost is still going to be lower, though. Taking into account shifts in demography, healthcare utilization, and coverage composition, we updated our previous analysis and found that single-payer universal healthcare would have saved $438 billion in 2019. A key factor driving the slight reduction in savings compared to 2017 is the increase in the number of U.S. Americans who are underinsured from 41 million to 45 million. In our analysis, we take into account that these individuals would likely have expanded utilization once provided with full healthcare coverage. In other words, no longer being underinsured. Given the small difference in savings between 2017 and 2019, we anticipate that 2020 savings would have been similar in the absence of the COVID-19 pandemic. National healthcare costs related to COVID-19. Hospitalization and healthcare fees attributable to cases of COVID-19 are much higher under the current system than would have been incurred under Medicare for All. In general, Medicare charges are 22% lower than those charged by private insurance for the same services. However, the discrepancy is even greater for COVID-19 in particular. Private insurers paid more than double the Medicare rate for a hospitalized COVID-19 case. To calculate the national expense associated with COVID-19 hospitalizations, we use the estimated cost of COVID-19 hospitalization, with or without a ventilator, stratified by whether the patient was insured, and if so, their type of insurance. While the average Medicare and Medicaid costs for a COVID-19 hospitalization that requires mechanical ventilation were $57,822 and $47,396 respectively, the average charge to private insurance was $114,842. $114,000. $115 if you round up, which you should because it's 8. Charges for hospitalizations that did not require ventilation were lower but showed a similar pattern across insurance types. We combined the age distribution of 11.8 million estimated hospitalizations through 12th of March 2022. Age-specific insurance, estimated hospital, sorry, there's a lot of brackets I'm trying to skip. Age-specific insurance coverage by type and age-specific probability of ventilation given hospitalization to estimate the proportion of hospitalizations in each age group that were reimbursed at each different cost level. Since the ratification of the CARES Act, the federal government has been reimbursing hospitals for the care of uninsured COVID-19 patients at Medicare rates. Therefore, we applied Medicare rates for uninsured individuals who were hospitalized. We calculated that the expense of COVID-19 hospitalization has totaled $365.8 billion US dollars, of which $141.2 billion US dollars occurred in 2020. If the Medicare rate had been applied to all hospitalizations, $105.6 billion would have been saved during the pandemic thus far, and $39.4 billion in 2020. Second to last screen here. Consolidating the expected general savings from a transition to Medicare for All with savings specific to COVID-19, single-payer universal health care could have cost $459 billion less in 2020 than our current system. These savings would alleviate the burden on employers and individuals to cover insurance premiums, co-pays, and deductibles. Since Medicare for All would achieve savings overall, the tax revenue needed to fund Medicare for All would be significantly lower than the healthcare premiums that are currently paid by employers and households. The Consolidated Omnibus Budget Reconciliation Act, or COBRA, of 1985 provided a mechanism by which individuals who become unemployed may temporarily retain healthcare insurance for themselves and their families. Comment is not super popular because it's usually really expensive. However, the unemployed individuals must shoulder the entire premium payments, including the proportion that was previously paid by their former employer, which on average is $21,342 for family coverage annually. $21,342 annually for family coverage. Due to a 2% COBRA administrative fee, the premiums paid by the unemployed worker are actually higher than that paid when they were employed. The American Rescue Plan of 2021 included subsidies to cover COBRA premiums for individuals who lost employment during the pandemic. So the Rescue Plan of 2021, they would let you keep that plan and they would pay the employer's share of it. So you just had to keep making the contribution, although a lot of those plans are still really expensive. You know, you'll be paying $400, $500, like sometimes more per month. And sometimes a lot more. It really depends on how many people are being covered by it and what level you got it to cover. An estimated $57 billion in subsidies will ultimately flow to insurers, because that's who's it's private insurance, so that's who's getting paid there. In 2020, many of these companies made multi-billion-dollar second quarter profits, double the amount for the previous non-pandemic year. Under a universal single-payer system, the recently unemployed keep their coverage, and the taxpayer is not subsidizing these profits. Yeah, because COBRA, so okay, People lost their coverage. Cobra lets them keep that private plan that the employer was getting the group rate on and making contributions to. But all the money just goes to a private for-profit insurance company. You don't want that. Last page. COVID-19 can also have long-term health and economic consequences. Among survivors of COVID-19, there can be substantial and often long-term morbidity. The debilitating symptoms of long COVID can include pulmonary and cardiovascular disorders, mental health impairments, neurologic symptoms, and functional mobility impairments. The cost of treatment for these symptoms is substantial. Uninsured individuals, including many whose unemployment was precipitated by the pandemic, would have to bear the full cost of these treatments. Further, long COVID may affect the ability to work, potentially reducing income or leading to insurance loss. As with acute COVID, affordability may be a deterrent to seeking needed care for long COVID, particularly for low-income families. We were talking about that yesterday in the Australian article, where they're like, oh yeah, you can get a physical therapist and an occupational therapist and like movement coaches and all this kind of stuff. Except in the U.S., where we don't have universal health care, you're not going to get any of that. Or you're going to pay through the nose for it. So yeah, by curtailing the spread of COVID-19, Medicare for All would also have reduced the incidence of long COVID. So you curtail the spread, and then that 20% of cases isn't going to be getting, 20% of cases roughly get long COVID. But you're going to reduce the number of cases, therefore reducing the, not reducing the percentage, but reducing the amount of people who end up inevitably getting long COVID, because about 20% get it. Additionally, medical expenses associated with long COVID would be lower under a more efficient healthcare system and covered for the patient regardless of employment status. Medicare for All as pandemic preparedness. And this is the end. The COVID-19 outbreak has underscored the societal vulnerabilities that arise from the fragmented healthcare system in the United States. So let me really underscore here, if you're not in the United States and your country has some kind of universal healthcare that is even close to the technological level of the United States, don't take for granted what you have, because what we have is a fucking nightmare. Nightmare. Universal healthcare coverage decoupled from employment and disconnected from profit motivations would have stood the country in better stead against a pandemic. Emergence of virulent pathogens is becoming more frequent, driven by climate change and other global forces. By the way, we're going to be doing 2 stories in a stream next week about other weird diseases that are emerging or re-emerging. There is a pneumonia that's just been detected in Argentina, which it doesn't seem to be COVID or any other recognized thing per the PCR test so far. They don't know what it is, but it's like a severe pneumonia that's been knocking people out. I don't know how far it spread. I think it was still in the single digits last I looked. But we've got monkeypox, and people have actually been talking about monkeypox for a few years. Now it's breaking out, but there's other stuff too, and we've got a couple of articles on that. Okay. Where were we? Universal single-payer healthcare is fundamental to pandemic preparedness. It is literally your baseline. We determined that such a system could have saved 211,897 lives in 2020 alone. Strikingly, it would have done so at lower cost than the current healthcare system, saving the U.S. $459 billion in 2020 at a time of economic tumult, to facilitate recovery from the ongoing crisis and bolster pandemic preparedness, as well as safeguard well-being and prosperity more broadly. Now is the time to transition to a healthcare system that can better serve the American people. It makes sense in so many ways. It is really some of the most reactionary elements that are fighting it at this point. And 70% of the country supports Medicare for All, last I checked. Among Democrats, only 8% of Democrats oppose Medicare for All. So 92% of the Democratic Party base either supports it or is neutral on it. And most are supporters. Yet, what percentage of Democratic Party politicians support it actively? Like Bernie Sanders, and he's not even really a Democrat. So it just goes to show why the left needs to break with the Democratic Party. At this point, Medicare for All is barely even a left position. I mean, it's left, but I mean, it is like the starting point. It's left of both, the largest 2 parties and the Libertarian Party as well, which is the 3rd largest party. So 70% of the country is left of, the organized political, capitalist political parties at this point. Green Party, the fourth largest party, is absolutely for it, on the other hand. So, these are some of the tasks. There's so many opportunities to agitate and organize around this and to do more education on it. I just read you one study. Take talking points from this, cite the study, and fucking do something with it. This people who do social research like this want the research to be used and cited and want it to be used for social change. So we're going to go on to this, and I'm going to close with this just because we're getting kind of near the end of the stream. I do want to check in with the chat. This is from the BMA. Public health response to UK governments to... excuse me. I'm having trouble reading today. It's probably because it's the fourth stream in a row. The public health response by UK governments to COVID-19. This is from late July, 28 July 2022, about a month ago. It's the fourth of 5 BMA reports, each with a particular focus on the pandemic response. So UK governments to COVID-19, and the report examines the approaches and key decisions taken by UK governments during the pandemic and the public health measures they introduced. It assesses whether these choices were timely, appropriate, and proportionate to deal with the threat and impact of COVID-19. So this is key, and they break it down into the 4 waves. The initial wave, the September to April 2020, 2021 wave, the third wave during May to December, and then the Omicron wave, December 2021 to the present. So we'll look at that in just a minute. I do want to check in with the chat first, but this is kind of part 2. So you have a country, obviously the NHS is under major attack and efforts to privatize, but it exists. And so this is, okay, you've got your universal health care, unlike the US. But the UK governments, what are they doing in the public health realm, which incorporates elements of the medical system, but also far exceeds it? Because this is a population health issue. It's one of the most contagious viruses known to humanity at this point. You've got to make alterations in social flow and social fabric in order to contain it. What have they done? Has it been adequate? I think we'll find, by and large, the answer among people working in healthcare and public health was no, the measures were not adequate. But let's check in with the chat real quick. Where were we now? Years from now, due to COVID, sorry, I don't know if it's on the agenda, but can we talk about the Opportunity 2510? I don't know what that means. Years from now, due to COVID as a mass disabling event, organizing around healthcare and disability rights, etc. I don't know what Opportunity 2510 is. That's just not ringing a bell. But if you can explain what that is. COVID is a mass disabling event. So, organizing around healthcare and disability rights. It would be great, organizing around stopping fucking COVID-19 so that we don't have to organize around disability rights if we can prevent some of the disabling events from happening. I mean, it's already too late for tens of millions of people, including I've had long COVID. But let's also organize around stopping this fucking disease. If they'd unleashed Medicare for All during the pandemic, people would have, or I hope they would have rioted if it were then rescinded. Yeah, and once it's out there, they can't pull it back. That's really the thing. Honestly, during 2020, and that was the first year that I was doing the channel, I was so heartened to see people out in the streets all during the spring and summer. Of course, it was, people weren't working, and the first thing that they started to do was like tearing the country apart. It was so good to see Americans finally standing up for themselves, because it's so incredibly depressing just watching no struggle happening, or just very muted struggle, muffled struggle. It needs to be happening now. I don't know what else to say, It's like, Yeah, we can talk about quiet quitting or the great resignation. We need loud in your face struggle at this point. It's so long overdue. I don't know really what people are waiting for at all. I know people are scared and this and that. How much worse do you want it to get? That's my question. Because it will keep getting worse. Only we can stop this. I mean, we collectively, the working class of the United States. I mean, so many people are hooked into like absolutely the wrong trains of thought in the first place is a huge problem. You know, listening to Fox News or whatever. But you know, of the ones who aren't, fucking do something. Let's see. I'm old enough to remember Bush. Bush was legit fascist, but the slimy Democrats ran with that. Yeah. So Bush. Oh yeah, when George W. Bush, we put that on the channel. Bush's speech where he's like, "The illegal invasion of Iraq. I mean Ukraine." Yeah, he said it like 3 times too. Some of us do remember that. And the thing about Bush being, you know, fascist, it wasn't the difference between Bush and the Republican Party during that time. Although it laid the groundwork for the Tea Party, birthers, and MAGA, it it wasn't quite a mass movement at that point. It didn't have that like revolutionary, air quotes, pseudo-revolutionary fascist energy. It wasn't this like grassroots movement at that point, but it did after the Tea Party start to really become that. I mean, it was astroturfed for sure, but it did kind of grow into this fascist mass movement. And that's where it starts getting really dangerous. In the Bush-Cheney years, they laid all the political groundwork for it, and of course, closed out the term with the 2008 meltdown. But the mass movement wasn't quite there yet. You'd see little pieces of it, like the Minutemen, the like those border militias. But it was really after Tea Party, birthers, and MAGA that it started becoming this like we will fight you in the streets kind of fascist mass movement. And did the Democrats stop that? No, they absolutely did not. It was just like they threw out Obama like that was going to fix everything. He really didn't fix anything. Capitalists want to make a profit on our suffering. That is what it's all about. Cuba is handling COVID well in comparison to all the U.S. imperialized Latin American states. Soviet Union dealt with the 1917 flu and 1957 outbreak the capitalist world completely ignores. Wikipedia removed COVID pandemic from their front homepage. The cover-up is, I mean, the downplaying is phenomenal. I mean, again, I would love it if COVID disappeared this fall and winter. I have things in my life I have put on hold because of the pandemic, because I can't risk exposure in beyond what I'm already doing, and it's just I want it to be over. And is it possible that we won't get a catastrophe this fall and winter? Yeah, but do I think that's likely? I don't. I don't. I ordered my COVID tests thanks to your last minute tweets. Good. Yeah, I know. I found out that literally the day before. U.S. was giving out free rapid tests if you ordered them through the USPS Postal Service website. They just ended that yesterday. So you can't even get free rapid tests by mail anymore. I don't know what they think is going to happen this fall and winter, but I do not think it's going to be good. Like, in fact, I feel like part of me is trying not to think about it because I think it's going to be really bad. I think it's going to be awful. The most thorough examination you can get in U.S. hospitals is that of your bank account. S4A, you mentioned being a leader and example. Yeah, like I guess you could say role model when it comes to masking. Have you personally noticed copycats or people following examples set by evidence-based actions like mask wearing at work or elsewhere in my personal life? Some. I'll say some. Some people, we'll just say some, not enough, but some. The amount of propaganda is, as well as people just not wanting, people are burned out. They're just like, I don't want to think about it anymore. I don't want to know. And I think there's this kind of fatalism of just like, hey, if I get sick, if I die, I die. And it's like that person who was in the chat the other day, Tuna Chip or whatever, that was like, look, I understand dialectical materialism and I've been living in my car for a while, but I just, on a gut level, have accepted the exploitation. And it's like, okay, I don't know what's going to help you there. Like, I think you just need to stand up for yourself at a certain point. But people are beaten down. That's why I think. That's why I think it's so good to see people out in the streets. You need that boost of morale to just be like, we don't have to take all this lying down. And it's the role of parties and organizations to lead effective demos and protests and unleash that energy, out into the world, which does spread and has many ripple effects, but not when you're just suppressing it all. I'm not saying the parties are specifically suppressing it, although they can play a role in that. But I think the socialist agitation needs to be a catalyst for helping to unleash that energy. As someone who lives in Europe, this just sounds insane talking about the U.S. medical system. I can literally go to the doctor and only pay something like $5. In the U.S., you can get cancer and bankrupt your entire family. It is anti-human and sadistic. Yes, it is. Yes, it is. Yeah. Here, if you wait maybe 10 years, a church might come along and pay off $90 of your $10,000 plus debt. Hell has to be described so horrifically because it's in competition with the United States. The silver line, no, I wouldn't call this, I see where you're coming from, I really wouldn't call it a silver lining, is that with the increasing proletarianization of the country, people have a lot less to lose. I think the problem is the consciousness, though. We have a very bourgeoisified population in the United States. It's the old Mark Twain quote of like, you may be working class, but you think of yourself as a temporarily embarrassed millionaire. That is a bourgeoisified proletariat. The realization more people need to come to is like, this isn't getting better unless we do something about it. And we're not going back to normal, which is like Biden's slogan. We need to go through to a new and better normal that we make. All right. Somebody's making a point about like disabilities are real and exist prior to COVID. Obviously, and many people who have some kind of pre-existing disability. We talked about pre-existing conditions are more susceptible to some of the worst outcomes of COVID. Yeah, absolutely. My other point was just in reading that and saying like, also, we should take advantage of the opportunity to prevent disability as well. So, I mean, yes, that's part of it. But I think, why I say that, people seem to be so quick to, are so adjusted to the horror and that it will just keep getting worse. And I think we need to push back on that thinking. Yeah, obviously, though, disability organizing exists for sure. I mean, it's like that's not a question, and that wasn't being challenged. So, anyway, let's get back in the articles. We're caught up with the chat now. So, all right, how prepared was the UK for a pandemic? The UK's pandemic preparation was inadequate, focusing entirely on an influenza-style pandemic and ignoring recommendations from previous planning exercises that would have ensured that the UK was better prepared to respond to COVID-19. That's kind of the thesis statement. Major reforms to the UK's public health structures, alongside a decade of underfunding, meant that well, it was more like the US, meant that public health systems across the UK entered the pandemic without the resources, workforce, capacity, structures, or voice that they needed to shape and influence governments' responses to COVID-19. Quoting an SAS doctor in England, the running down of public health funding progressively over the last decade left the public health service understaffed and under-resourced, and this inevitably reduced their ability to manage the pandemic. So this is neoliberalism. Key recommendations. 1. All UK governments should review their public health structures to ensure that expertise is located where it's needed and is included as part of government decision-making, particularly at times of national crisis. So this is if the capitalist politicians are willing to listen to you. 2. All UK governments should adequately fund public health services wherever they are located to enable the nation to better respond at a rapid pace during future emergencies. 3. All UK governments should urgently increase the numbers of public health staff at a local and national level and increase the number of public health training places provided. So those are the key recommendations. We talk a lot about science being constrained by capitalism. In other words, the science can indicate this, the evidence can indicate this, but in capitalism, profits always come first. So if it's not profitable, it will be reduced or ignored entirely, just sidelined. So this is the problem, and we as socialists need to push on, anybody of good faith interested in science in particular needs to understand if you are for science, you cannot be for capitalism, because capital is a muzzle on science time and time again. If you're for medicine, if you're for public health, whatever it is, you cannot be for capitalism because, far from providing innovation and whatever else, it's going to strangle the implementation of these things in society. Questions for the inquiries, I guess as they would say in the UK, inquiries. Why did the UK's pandemic preparation focus entirely on an influenza-style pandemic? What impact did this approach have on the UK's initial response to COVID-19? 2. Why were recommendations from pre-pandemic planning exercises not acted on and included in COVID-19 plans? 3. How, if at all, could local public health expertise, such as health promotion or protection, could have been used more effectively in the response to COVID-19? And 4. What was the impact of public health structures, long-term public health funding, and public health staffing levels on government responses to COVID-19? How could these be improved to ensure that the UK is better prepared for a future pandemic? So, this is a case study of the UK. Many of these principles will apply elsewhere because the basic principles of medicine, public health, the pandemic, and capitalism are found throughout the world. First wave, February 2020 to September 2020. The UK failed to act quickly in response to the emergence of COVID-19. There was no clear policy approach at the start of the pandemic, with initial contact tracing abandoned in mid-March, holy fuck, and a significant delay before population-wide distancing strategies were introduced. Delays continued throughout 2020. For example, there was a gap of 2 to 3 months between face coverings being recommended by global health agencies and this advice being implemented by UK governments. So 2 to 3 months, the WHO said, hey, use masks, and the UK government just sort of thought about it for a few months. Now, this happened elsewhere. We saw Fauci in the US kind of waffling and going both ways on that. And that cost lives, no doubt about it. Not to mention, the whole thing about social distancing. I have an amusing graphic here. My favorite social distancing metric, always stand at least 2 Ben Shapiros apart. I can say that because Ben's not here in the studio with us today. He is at a special socialist education facility, preparing for his re-emergence on the show. But social distancing, it's helpful to a certain extent, helps prevent droplet transmission. What's the problem? We found out that COVID is airborne. So it travels through the air, not just through heavy droplets which fly a certain distance, but then due to gravity sink to the ground. They're aerosol. They stay suspended in the air for prolonged periods of time, hours. So social distancing is only going to get you so far. And then when the masks came out, for a long time it was just cloth masks or surgical masks, which still have a gap around the sides. Really needed to be N95 masks, and the response on this was so incredibly sluggish and slow. Just wanted to mention that. All right. Delays continued throughout 2020. For example, there was a gap of 2 to 3. Oh, sorry, that was that one. During the summer 2020, the UK failed to prepare for a second wave. Yeah, because, at that point, the struggle was all on like the lockdowns and reopening and back to work and all this kind of stuff. And it's like the pandemic literally just started. We still haven't figured out effective strategies. And there was like all this right wing clamor for like there to be no control to transmission or anything. Fortunately, there was, and things weren't as bad as they were, or as bad as they could have been, but insane. I just need a drink of water here. All right. Failed to prepare for a second wave. Public health messaging became mixed and confusing. We have now completely surpassed that stage in the United States. And the dominant political narrative focused on ending restrictions rather than caution and preparation for an expected increase in infections in the autumn, which is the second wave. The UK, and what's happening now? People are forgetting that the word pandemic ever entered their vocabularies, is basically how we're entering this fall. The UK government failed to use this time to build effective systems for testing and contact tracing, leading to significant UK-wide testing backlogs, and in England, outsourced contact tracing, which turned out to be a critical and costly failure. Quote from a consultant in Scotland, "Did they not see what was happening?" Should I do a Scottish accent? No, I should. Did they not see? I'll never be able to do that well. What was happening in China, Hong Kong, Singapore, and Italy? It was like they thought it would not come here, said consultant in Scotland. Consultant in England said, it's so tempting to read these in an accent, I will refrain. Too little, too late. These measures worked, but they seemed always to be deployed only when it was absolutely obvious that something had to be done. They would have been so much more effective. So much less disruption and harm would have been caused if they had been deployed earlier and been followed more assiduously. And we have a nice pie chart here. 2 months into the pandemic, over 2/3 of doctors told us at the time that they did not feel confident in how their government had handled the pandemic to date. This lack of confidence was highest among doctors working in England, 70%, and lowest among those working in Scotland. I wonder if right-wing political leanings have anything to do with this, but you can see there that overall, not very confident and not at all confident added up to 68%. 3% were very confident, sort of insane like maniacs, way on that end of it. Reasonably confident, 27%, not sure, 3%. So over 2/3 not confident, not very or not at all. And then differences by country. Lack of confidence was highest among doctors working in England. I would have expected. No, that's interesting. I wonder what accounts for that. Honestly, this is where qualitative research and interviews about why, can flesh out some of those details. Slide 2. In a survey in June 2020, almost 7 in 10 doctors told us that they did not feel confident that their country's test and trace system would be effective at containing the spread of COVID-19. There's a very funny thing at the bottom that I'm going to follow up on. But so this is in June, and not at all confident, 29%, not very confident, 40%. So the don't know has increased, the slightly confident has decreased, the very confident stayed the same. So basically, confidence dropped. Now at the bottom there is the key recommendation. The UK must assess the impact of the Eat Out to Help Out scheme. I read that and just spit out my drink. That was a real thing that they did on both the economy and COVID-19 transmission to guide similar decisions and debates in any future pandemic. So the Eat Out to Help Out campaign, this is a real thing. You can find this in the UK Parliament House of Commons Library. The Eat Out to Help Out scheme was one of the government's policy measures to support businesses reopening following the first COVID-19 lockdown. The scheme aimed to help protect jobs in the hospitality sector by encouraging consumers to eat out. This briefing summarizes reactions to the scheme and figures on the scheme's take-up and impact. real thing, and they analyzed it in December of 2020. Again, it's like, if people stop eating out at restaurants for 2 weeks, like the economy collapses. Anyway, so back to the graphic there. I believe that there is a third graphic. Confidence in their country's test and trace system was low amongst doctors in all 4 UK nations during summer 2020. However, confidence at the time was particularly low in England. Oh, I get it. Okay, so I'm so focused on reading, the part of my brain doing analysis is not always as swift. But so Scotland, in other words, had more confidence that the Scottish government was going to be handling it better. People in England felt that the English government was going to do a particularly bad job. Got it. So there you can see the breakdown of, the not at all confident is clearly highest in England. Wales and Northern Ireland is 22 or 23%, and then significantly lower again in Scotland. So, continuing. Questions for the inquiries. How and to what extent did the UK government assess the situation in China in early 2020 as a potential threat to the UK? So in other words, in China is where the first major outbreak was noted, and they're again making it out as like this is the situation in China. However, we know that COVID was detected in wastewater in, for example, Italy as early as December. So, as far as this being, people have asked on occasion, I don't get it so much anymore, because again, COVID is over, quote unquote. So people don't bring it up as much, but, and again, COVID is obviously not over, but a lot of people have just sort of moved on. Anyway, people ask, what do you think about the origins of the virus question? I think that, maybe after we contain the virus, we can try to figure that out. Right now, the focus needs to be on containing it. If you're not containing the spread, it doesn't really matter where it came from. And I don't think that it's going to lead to any breakthroughs in trying to contain it. But as far as China being, blamed for this, which, Trump was trying to do, and the Republicans and, various factions were trying to do to just sort of score points against China, promoting a new Cold War and stuff like that. That really may not be the case at all. In fact, if you look at one of the studies, and I can do it, I can bring it into one of these live streams. I can't do it today. But there was selection for people who had been to that particular food market in one of the first reports about the whole thing. So if you got COVID in China and you weren't at that food market, they weren't even counting you. So it's a good way to get it biased. I'll get the details on that, and I'll bring it into a stream in the future. Anyway, continuing. So to what extent did the UK government apply precautionary principles as a consequence? So in other words, they saw a situation, whether it was in China or wherever it was, and at what point did they go, hey, that could happen here? And did they act in a precautionary way appropriately or not? Question 2. What information did Public Health England, PHE, use to inform its advice that scaling up capacity for testing was not possible? Given that this course of action would be implemented just weeks later, was this advice from PHE challenged sufficiently? So Public Health England said that they couldn't scale up capacity for testing. It wasn't possible. But then weeks later it was done. So what? What happened there? 3. Following the decision to shift capacity away from contact tracing on 12 March 2020, that is so early. That's amazing. That's before it was even declared like an emergency here in the U.S., I think. Why did it take 11 days for the UK government to introduce population-wide distancing measures when it was already known that community transmission of COVID-19 would likely overwhelm the system? This really is the kind of who knew what and when series of questions. What role did behavioral science play in the UK government's decision not to quickly impose a package of NPIs, non-pharmaceutical interventions against COVID-19? Was this driven by an incorrect assumption that adherence would quickly wane? And finally, why did the UK government spend the 7 days from 16 to 23 March 2020 advising voluntary behavior change rather than introducing lockdown? Actually, it goes on. What was the impact of high-profile failures to adhere to lockdown rules on public support and adherence, or we would call it probably compliance in the U.S.? and on trust in COVID-19 interventions. So when you see the leaders not following it, like there was that thing of like Gavin Newsom having dinner in a restaurant, and that was a scandal, stuff like that. I mean, definitely the anti-lockdown activists used that as, I think, pretty effective propaganda. So I would say it clearly had a negative effect on public support and compliance. Some people would still support it and just, get mad, but some people, would just use it to support whatever they wanted to believe in the first place. Anyway, why was the decision to require mask wearing in public taken as late as it was? What roles did the shortages of PPE play, caused by a lack of adequate stockpiling and maintaining of national stockpiles? Why were UK governments not more cautious during the summer of 2020, and how effectively did they use this time to prepare for a second wave? Why did the UK government choose to outsource extensive testing and opt not to use existing public capacity? Could better value for money and effectiveness have been achieved by using existing public sector laboratories? What was the structure, value for money, and performance of the various contact tracing systems deployed across the UK throughout the pandemic? So now getting into the second wave here, this is September 2020 to spring of 21. So basically that whole fall and winter wave up through early spring, and of course that was when the vaccines really started getting rolled out to the general population, was that spring. As a result of ending the first lockdown with no coherent plan for keeping COVID-19 at bay, infection rates rose rapidly. Local lockdowns and localized restrictions were introduced from summer 2020, but these failed to sufficiently contain the spread of infections. Communication and information sharing between national and local government was poor, and it undermined the implementation of local restrictions. Public communication became even less clear during the second wave, limiting people's understanding of local measures. Last-minute changes to restrictions during Christmas 2020, I remember that, created, like all the people trying to get on trains and stuff like that, created confusion and frustration, severely damaging trust in public messaging. The vaccination rollout signaled a turning point in government's pandemic responses. The NHS-led rollout of the vaccination program was a vital success during this time and signaled a move away from lockdowns. Rightly or wrongly, let's say. However, although the overall vaccination rollout was hugely successful, governments need to do more to address inequity in vaccine uptake and to combat anti-vaccination messaging. I will agree, also in the US, the anti-vax messaging, or the combating anti-vax messaging was poor. And then it was also very limited in duration. Quoting a public health consultant in England, local authorities routinely had access to no or very little data, often well after the fact, such that they felt unable to truly understand the impact that COVID was having on their populations. This was not remedied until well over a year after the initial declaration of the public. So local authorities didn't even know what was happening in their communities. Key recommendations. All UK governments should review their approach to or policy on localized restrictions in the event of a future pandemic to ensure that, if used again, these processes are clear, inspire confidence, and are enforceable. Questions for the inquiries. What was the effectiveness of local lockdowns on case rates and their wider implications on the well-being of populations affected? How effective and consistent was communication and information sharing between national and local government, particularly around the implementation of local lockdowns? How effective were government's public communications, including cultural competence? And the cultural competence is being able to speak to people of varying cultures effectively. And the impact of these communications on adherence to and understanding of restrictions. Why did the UK, Northern Irish, and Welsh governments, which had adopted circuit breaker lockdowns, choose not to extend them, only to implement national lockdowns a month after they ended? Third wave, May 2021 to December 2021. So this is basically when the vaccines were really rolled out up through the start of Omicron. Despite mass vaccinations, but not really including Omicron, despite mass vaccinations, COVID-19 cases and hospitalizations remained high moving into the third wave. The rapid spread of the Delta variant put even greater pressure on the UK's health services, which were working at the limits of their capacity to deliver both COVID-19 and non-COVID-19 care. you would hear, I mean, just the stories of burnout were everywhere. During January of this year, 2022, I was doing a story a day for 2 weeks on this, including many on the burnout and how many healthcare workers were quitting. The UK government unnecessarily politicized public health measures by framing the removal of restrictions in the context of freedom. Very good point. When you say we're removing the restrictions and giving you your freedom, then if you have to impose restrictions again, you're going to have a bunch of people thinking that they're like, Braveheart, or like, they're in V for Vendetta or something. More balanced messaging was needed around actions that were advisable to maintain even without legal requirements in order to control the spread of COVID-19 and protect the most vulnerable to severe disease. Quoting a junior doctor in Northern Ireland, communication is key, and as with so much else, the government's communication was woeful. Even now, the community are confused as to why the vaccine is not eradicating COVID. And you hear this constantly, too, in the U.S. Well, COVID doesn't stop infection. Yeah, and that's kind of the thing. It would be more consistent if we were still doing targeted shutdowns and things as needed, and then the government just telling people, well, the vaccine reduces your odds of getting the worst outcomes, but it's not sufficient to completely control the pandemic. That would be much less confusing. But people are being told that they're like, the enemy of humanity if they don't get the vaccine. But then at the same time, some of these people are legitimately confused about like, well, what's the vaccine actually doing? Why is it so important? And that messaging is half-assed at best. And of course, the approach that they're taking is contradictory and not evidence-based. The vaccines were never going to completely stop spread. You can see to date, we're a year and a half out, and we have much worse strains now. So, yeah, some of that confusion is legitimate. Anyway, continuing, the end result being that people are not careful enough, and we have ongoing problems in society and healthcare. A couple of graphics. In November 2021, so this was right before Omicron, during the Delta wave, only 25% of doctors said that they felt confident in the current approach to managing the spread of COVID-19 in their country. 3% very, 22% somewhat, and then everybody else, 75%, not confident, 2% didn't know. At the start of the vaccination rollout, almost 9 in 10 doctors told us that they were concerned about how anti-vaccination messages would impact on the uptake of the vaccine. So that's a lot of concern. And then actually, so it's almost 9 in 10. Well, so 7% were not at all concerned, 5% didn't know, everyone else was slightly or significantly concerned. That's a lot of concern. And correctly, I mean, that's people were rightly concerned about that. And we see how extensive, speaking of the UK, there's Russell Brand, did a video on him and his support for the Flu Trucks Clan, the Canadian anti-vax neo-Nazi truck rally. And the anti-vax messaging is substantial and pervasive. Anyway, third graphic. Over a third of doctors told us in September 2021 that they did not feel supported by their government to ask a patient or visitor to wear a face mask if they were not already doing so. So people, there was a good question about, do I feel like, I obviously am a champion of masks on and offline. Do I feel like it's made an impact? It's like, well, yes, somewhat of people I know, but you're up against so much organized, effort just saying COVID is over. I mean, the fucking White House in the United States doesn't get much higher than that, saying mask or vax as of May 2021. I can't compete at this point in time with the White House. So, yeah, I mean, it can have an effect, but the left as a whole needs to come together around this message. So over a third of doctors during the Delta outbreak said that they didn't feel supported by their government to ask people to wear face masks. That's crazy, so trying to work against the government on basic public health measures. Questions for the inquiries, and this is the third to last screen. How effectively did UK government support clinically extremely vulnerable, or CEV, people as they shifted towards policies of relaxing restrictions that focused on limiting the spread of the virus? So in other words, as they let the virus spread, how were clinically extremely vulnerable people supported? 2, were the clear public health advantages of lifting restrictions, particularly to the population's mental health, appropriately balanced with serious concerns around the impact of this wave on healthcare services and workforce capacity? How effectively did governments and relevant health agencies respond to the emergence of long COVID, and how have they continued to both treat and support those suffering from it? Given the high levels of COVID-19 cases and hospitalizations, was the rate at which restrictions were lifted during the third wave appropriate? To what extent was data on vaccination coverage balanced with other factors such as case rates, hospitalization rates, and the impact of long COVID when making decisions about easing restrictions? Now the fourth wave. This is Omicron to now. The BA1, BA2, BA3, 4, 5, and whatever is coming next. The Omicron wave spread rapidly and caused widespread concern about the impact on the UK's health services during winter, an already precarious time for the UK's health services. As I always say, people generally are weaker in the winter. More people die in January than in any other month, year after year. And more indoor air, all kinds of stuff, less sunshine, lower vitamin D levels, etc. To limit this threat and reduce rising staff absence rates, governments should have reintroduced measures far earlier than they eventually did. In early 2022, all 4 UK governments published strategies for replacing legal restrictions with guidance. However, so this is shifting from hardline restrictions to just, advice. However, the removal of key public health measures such as free testing, self-isolation support payments, and statutory sick pay provision in England created a 2-tier system where only those who could afford it could protect themselves. Well, what's happening now in the US? Since these strategies were published, public health messaging has frequently failed to be widely disseminated. A lack of clear government guidance, gaps in vaccine coverage, and limited consideration given to the prevalence and impact of long COVID all raise questions about how groups most at risk, like the clinically vulnerable or unvaccinated, are being adequately protected. The dismantling of pandemic infrastructure, including the scaling back of public health services, testing capacity, and prevalence monitoring, is premature and jeopardizes the UK's response to any future spikes of the virus or, critically, any new pandemic. A critical lesson of the pandemic is that timely and decisive action saves lives, while inaction puts them at risk. The BMA has therefore responded to current worryingly high rates of COVID-19 cases and tragically increases in deaths from the virus by calling for the reintroduction of mask wearing in health and care settings. Rapid action from all 4 UK governments is critical to protect patients and NHS staff. Key recommendations. We call on all UK governments to focus resources on promoting the COVID-19 vaccine amongst at-risk and under-vaccinated groups. All UK governments should take steps to ensure that the staffing, tools, and facilities needed to address any future pandemic can be scaled up quickly if necessary. All governments must reintroduce or reemphasize mask wearing in health and social care settings to protect patients and staff. And finally, questions for the inquiries. Why were alternative approaches to managing high rates of infections, including the reintroduction of previously withdrawn measures, not adopted before December 2021? To what extent was the prevalence of long COVID, which is associated with poorer health outcomes and increased demand on NHS services, considered in decisions by UK governments to ease restrictions? I don't know if it was considered at all, honestly. What was the basis for the UK government removing remaining legal restrictions in England and key public health measures such as free testing and self-isolation support payments when the Omicron variant, with its high transmissibility, still had yet to peak? So the thing hasn't even reached its peak, and they're tearing down the support for containing and dealing with COVID. Has the failure to accompany the removal of most COVID-19 protections with clear, consistent, and ongoing public health messaging hindered the ability of UK governments and the public to realistically move to a sustainable strategy of, quote, living with COVID? Look, there is no living with fucking COVID. You control the thing and you make it extinct. That's what you do. How are the UK governments maintaining or disposing of their pandemic assets in the form of workforce or facilities in particular? Does this risk undermining any future pandemic response? Well, I will say somewhat unsatisfying conclusion to that article, although, overall, it's nice to have somebody attempting some kind of a post-mortem here. In fact, I have a couple of articles about recently Rochelle Walensky of the US CDC has made comments about, how they fucked up and how they are going to be maybe reorganizing the CDC. Meanwhile, this shit is ongoing and they're not doing anything about it. So, I mean, it's just like you're trying to do like a mea culpa and, vow to do better in the future. Forget the future. Literally right now, the shit is still going on. What are you going to do right now? So we'll cover that as well in the future. But anyway, checking back in with the chat, and then we got to wrap up, and then you won't see me streaming for a few days, but we will continue the COVID stuff until it's all done. It will take at least 4 or 5 more streams. But anyway. Yeah, problem being, the foremost U.S. expert in pandemic response came out against masks and told the whole world they're useless just because of a domestic shortage. Talking about Fauci. Another one, I don't have a single friend who tries to avoid getting or spreading COVID. I've been forced into poverty because I just can't get it. Fist bump. You're not alone. But I tune into some Marxist podcast and it's all about... I tune into some, quote, Marxist podcast and it's all about live shows, bars, and back to normal shit. Yeah, the U.S. left has failed on this. Many left parties, not just in the U.S., have failed on this. Some are doing right by people on COVID, but yeah. I'm gonna do what I'm gonna do on this, and I don't get too much squawking out of the S4A comments about the continued coverage of COVID. I'll certainly be testing people's patience with it during the month of September because we're gonna do, about 90% COVID coverage in the live streams and everything. But it's important. Like, this is ongoing. It's still a problem. And I hear you I have had to make real compromises in what I'm doing because of COVID. I don't like it. I want this thing to be over. But you can't just wish it away. You can't just get, hashtag COVID is over trending on Twitter, and that doesn't make it so. Having social outcomes that you want requires difficult struggle, and struggle against a virus is... difficult. It requires participation. We have a fragmented society with deep rifts and major contradictions. People have, enormously powerful minority has interests which are diametrically opposed to everyone else's. And too many people in the majority, working class majority, are buying into it. They're confused. And the class collaboration in a pandemic is, genocide. Just mass disabling, mass death. So, anyway. The comment continues, the upside is I've learned how to survive on so little and really live a better life all the same time aside from society. Yeah, learning how to exist without money in the United States is very challenging. But, to what extent you can learn to lessen your dependence on money, it's worth it. Learning to just not... be able to get stuff done without so much money. It's an interesting challenge. And there's plenty of things you just can't do. So it's not like that is a solution. It's not. But I hear you. I'm glad that you have found some things that you can do instead. I really can't wait for this to be over for real because I miss doing activism, but it's just too dangerous right now. People knock on poverty cult stuff, but man, I love giving the ruling class as little as possible. Yeah, the IWW, Wobbly's anti-capitalist labor union, it stands for Industrial Workers of the World, but people used to mock them saying, oh, I guess it really stands for I won't work. But then the IWW picked it up and said, well, I won't work for capital. Fuck you. I'm withholding. That's part of it. That's part of resistance. We obviously have to organize politically and in unions and everything, but... yeah, I hear what you're saying. COVID really pushed me over into full-on socialism, a system with our level of industrial development that can't roll out N95s to everyone as soon as they're needed. It needs to be replaced. Capitalism is not salvageable. Yeah, it's, a point I say a lot I like is like, if you can't even house, feed, and protect everybody from diseases. What is the point of fucking civilization? And of course, we know, class struggle and class exploitation and everything. But what's in it for you as a working person? And could we make a society where we control it and we use all this technology to actually meet those needs? Absolutely, we can. There have been examples of it before. We can do it again. I work in healthcare as a medical coder. I help to keep doctors from committing fraud. What kind of fraud are you talking about? Another comment. I've been using an elastomeric respirator that I had because I'm a welder. It's $30 and filters out way more than an N95 with swappable filters. Everyone should be able to have this level of protection. Yeah, so just one website I know off the top of my head, Project N95. Look that up. Just write Project N95 masks, and they sell N95s and they sell P100 masks. That's the elastomeric. People have said that you can also get paper or disposable P100 masks. It's probably more efficient to get one of the respirators and then you just change the cartridges every once in a while. They're not expensive. You can get them either with exhaust valves or without. So without, your breath gets filtered on the way out too. That way, if you have a COVID or anything else, it will stay in the mask and not get filtered out to other people. But seeing as how no one else seems to give a shit at this point, whether you wear an exhaust valve or not, it probably won't matter to anyone else. If you want to be, kind to others, get one without an exhaust valve that will filter your exhalations as well. But either way, P100 is really going to protect you. It is the gold standard as far as airborne viruses and stuff. N95 is the bare minimum. Every office and business should have been required by law to hand them out like napkins or tissues. Absolutely. Richest country in the world could have done it no problem. Too many getting sick. Still through N95 after Omicron especially. Yeah, I don't know if people wearing N95s are still getting sick in huge numbers. I mean, N95s are not 100% bulletproof, but they will give you hours of much better protection. And the masking discipline is bad too. Still think that taking them off to eat is safe. Or when outside. No. Especially with BA5 now, expect to catch it outdoors. This isn't, the messaging has been flat awful and counter science from the U.S. on that. No, you can catch COVID outdoors for sure. If you can smell people's cologne, you should be wearing a mask. Yeah, absolutely. So that's the thing. Yeah, you can smell cigarette smoke or whatever, then small particles are reaching your face from wherever someone else is. We are one variant away from mass deaths. Your COVID coverage is solid. Thank you. Well, thank you. We are one variant away from mass deaths. So here's a point I would like to end on, and I don't have stuff prepared for it, but SARS-1 and MERS mortality changed over time. And off the top of my head, so looks like SARS-1 from around 2003, 2004, which was contained because it was handled responsibly, had about overall 9% mortality, but if you were over 60, 50% mortality. That could be wrong. That's what so global cumulative total, according to one study on PubMed, case fatality rate of 11%. So you got around 11% mortality. That's much higher than COVID, SARS coronavirus 2. As far as MERS, Middle East Respiratory Syndrome coronavirus, let's see. Mortality rate closer to 35%, but this may be an overestimation per the WHO because milder cases may have been missed by existing surveillance systems. But, okay, let's say that it's 10% overestimated. You've still got a virus that has 25% mortality. That's terrifying, and COVID has mutated to become more severe before. COVID is the name of the disease, but like obviously people use it somewhat interchangeably with the virus. SARS coronavirus 2 has mutated before to become significantly more dangerous or virulent. For example, the Delta variant was way more severe. It could cause much more disease than the earlier strains. It was also much more contagious. Omicron, slightly less severe than Delta, but more contagious. And then as the Omicron family, the BA dot whatevers, have progressed, they become even more contagious. Like each one is 20% more contagious than the last. BA5 having some of the Delta mutations and being the most contagious strain. That's why it's so dominant. So what if it mutates again to become, suddenly there's a massive uptick in mortality. Like we get a 10% overall mortality rate like SARS-1. What then? These are scenarios that, I really am not trying to be in any way insensitive to people who have an existing pre-COVID disability. Far from it. That's why we're doing a lot of this coverage. But why I'm saying like we need to stop this, like, so that we're not doing like, we don't have a population that has, 50 million people disabled by COVID. If we can stop it at 15 million, let's do that. That's what I'm saying is like, rather than just accepting like a slide into the worst possible scenario. This is where it's at now, and it could easily get worse if the virus mutates to, just kick our asses harder. That's entirely possible. And so, the arrogance and just ignorance of COVID is over. Nobody cares anymore. Like just all this premature, like trying to just wave it away, wish it away. What happens if, in the not unlikely scenario that there's another mutation for much more increased morbidity and mortality? What then? Then all these people have to walk it back, and I don't think they'll be able to. I don't think that with the investment that they've made that they'll be able to walk it back. And so we'll be in this massive struggle over a virus that will be much worse than what we've already seen. And it's bad enough as it is. You got a virus that, has killed over 1 million people in the United States so far. And then, of course, they'll hit you back with like, oh, did they die with COVID? Or, did they die with a gunshot wound or because of the gunshot wound? Etc. Well, okay, they died with COVID and something else, but did the COVID push them over the line into death? That's the point. Okay? But people saying that don't understand that. They just want any excuse to wish it away. And that's what's so frustrating to me, and that's why we're going to keep hammering on this issue, because we need a resurgence of concern and informed ability to, advocate for all the protections that we need. Yes, as the comment says, as Jeff Goldblum said, life will find a way. Absolutely. So anyway, that's about all I've got for today, and I will be back streaming next week. Everybody have a good U.S. corrupt fake Labor Day holiday. Obviously, real Labor Day is International Workers' Day, May Day. But the U.S. has a special one so that the U.S. proletariat does not feel solidarity with the rest of the global proletariat. So anyway, but enjoy whatever time off you may get. Not everybody gets the time off. But whatever it is, try and enjoy yourself. Know that other workers are, whatever you're facing, other workers are experiencing it too. You are not alone. We are in this together. And that's part of where the organizing comes in. That's where we can functionally be together and not alone. Of course, COVID is putting a damper on that in some respects now. But anyway, take care of each other. And there is one last comment. Our society excelled at ignoring disabled people before COVID. It will continue to after. People say they don't know anyone impacted, but I suspect that they do, but have just not checked in. Yeah, no, I've encountered that as well. People are like, I don't know a single person who has, quote, long COVID. I'm like, well, okay, skillfully you managed to dodge the 20% plus of the population that does have it, but hey, you've met me and I've had long COVID. But I guess you're just going to say you don't believe me. So if you're going to do that to me, then probably you're doing it to other people in your life as well. And just to say again about the disability rights, you're absolutely correct that U.S. society and many societies excelled at ignoring disabled people before COVID. This has always been a problem, even sometimes within socialism hasn't always gotten the priority that it has. I think that to a certain extent, these sort of newly disabled with long COVID will have to sort of make peace with and take lessons and guidance from and give respect to the people who have been doing disability rights organizing previously. There's a lot of lessons that need to be learned there, and that needs to be respected. So, yeah, and talk about a depressing note to end off on, but not even just COVID, but being psychologically affected, the amount of suicides have gone up. COVID has fucked with everyone. You're absolutely right. And probably, also that's from work instability. We've covered that before. People in Canada applying for medically assisted suicide, or medically assisted death, MAID, they call it. I guess MAD didn't sound as nice. We've covered that before, and it's economic because people got long COVID. There was a case study of a woman who used to work as a chef, and she got long COVID, couldn't work, had to sleep all the time, and is applying to be put to death because she just can't pay her bills. So that's where we're at, and I assume for other people, just the pain of living with the cognitive disabilities and everything caused by it. After being, living for 40, 50, 60 years without that, and then suddenly being plunged into cognitive impairment or whatever. Also, COVID can cause depression, so that too, it's bad stuff. It's bad stuff. But anyway, really, people are not alone, and will continue to approach COVID from all different angles. This is probably just going to be the theme of the month for September, honestly, because there's so much I want to cover with it. Somebody says, damn, you're leaving. I just discovered you. Well, head over to the YouTube page, youtube.com/socialismforall. Subscribe. We do content regularly, so we'll be back again streaming next week. All right, we've been going for almost 3 hours. Again, have a good fake Labor Day. And, sorry, I saw another comment and whatever. I want to keep going, but I really do need to go. Have a good whatever it is that you're having, and we'll catch you in the next video.